Hi, I'm going to talk about the muscles of the hip, and the references I'm going to use are primarily the Trail Guide, but I'll also use reference Newman's book occasionally. So you think about the muscles of the hip, I'm going to talk about them in terms of compartments. I'm going to talk about an anterior compartment, a medial compartment, a posterior compartment, and then I'll also talk about the gluteal muscles, which you could kind of consider maybe the lateral compartment. Okay, so we'll start with the anterior compartment, and that's going to be your hip flexors are going to be in front. You have your iliopsoas, which is actually a combination of your iliacus and your psoas major. You have your rectus femoris, which is one of the quads group. You have your sagittarius, and you have your tensor fasciae lata. You also have pectineus and adductor longus, but I'll talk about those with the adductor muscles. So the iliopsoas is a combination of the psoas major and the iliacus. The psoas major comes from the bodies and transverse processes of the lumbar vertebrae, and it's going to insert onto the lesser trochanter. The iliacus muscle comes from the iliac fossa, also goes to lesser trochanter. Again, it's commonly combined as the iliopsoas muscle. And the psoas major, its nerve innervation is the lumbar plexus. So remember, it comes off the lumbar vertebrae, lumbar plexus. And the iliacus muscle is the femoral nerve. And most of the muscles in this compartment are femoral nerve. Now you have the rectus femoris, which comes from the anterior inferior iliac spine to the tibial tuberosity, where all the quads insert into, and it will flex the hip and extend the knee. Remember that it's only the rectus femoris of the quads group that flexes the hip. So sometimes students will say, when I ask about hip flexors, they'll say quads. Remember, quads really refers usually to knee extension primarily. The rectus femoris is the only muscle that will cross the hip, and its nerve is femoral. The sagittarius muscle is from the anterior superior iliac spine, and it's going to come down to the medial. Can you see that? Lift it up. It comes down to the kind of medial proximal part of the tibia. It inserts into what's called the pes ancillaris tendon. The pes ancillaris insertion is actually 3 tendons, one of which is the sagittarius. There's also the gracilis and the semimembranosus. The sagittarius is going to flex the hip. It's also going to externally rotate at the knee, and its nerve is femoral. And then you have tensor fasciae lata, which is from the posterior iliac crest behind the anterior superior iliac spine. And the tensor fasciae lata comes down and inserts into towards the base of what's called the iliotibial tract, or the IT band. And the IT band, or the iliotibial tract, comes out of the gluteal fascia. It's a thick connective tissue. It kind of funnels into a cable and comes down here. So that tensor fasciae lata is going to insert kind of towards the distal end of the femur into that iliotibial tract. And the tensor fasciae lata is going to flex the hip. It is also going to abduct the hip, and it's it's a significant abductor as well. And the nerve for the tensor fasciae lata is the superior gluteal, which kind of puts it in line with the other gluteal muscles. Okay, so those are your hip flexor muscles. Moving on to the medial compartment. Okay, so that's going to be all inside here. You have 5 adductor muscles. You have adductor magnus, which is the deepest. You have adductor brevis, which is kind of in the middle. You have adductor longus and pectineus, which are more superficial. And the most superficial is the gracilis muscle, which comes up very much on top. So the adductor magnus has 2 heads. It actually has an extensor head and what's called an anterior adductor head. The extensor head is very similar to the hamstrings. So it's going to come from the ischial tuberosity and insert onto the adductor tubercle down here. It will extend the hip, and its nerve is tibial. Again, that's similar to the hamstrings. The adductor head, or the anterior head, is going to come from this inferior ramus of the pubis and ischioramus, and it's going to insert onto the medial lip of the linea aspera, and that is the adductor head of the adductor magnus. And its nerve is obturator, okay? And you'll notice that pretty much all of the adductor muscles, almost all of them, have obturator as a nerve, okay? The adductor brevis is going to come from the inferior ramus, okay? And it's going to insert into the medial lip of the linea aspera, and it is going to adduct. It's also going to internally rotate, which most of the adductors do, and its nerve is obturator. The adductor longus is going to come from the pubic tubercle, and it's going to insert again onto the medial lip of the linea aspera. And it can, aside from adducting and internally rotating, it's also considered a hip flexor. It partially depends on the position of the femur, and its nerve is obturator. The pectineus muscle is going to come from the pectineal line on the pubis. It's going to insert onto the spiral line of the medial lip of the linea aspera. And the pectineus is an adductor. It's also a flexor, and it is one of the muscles that its innervation is the obturator and the femoral. Okay, so that's a nod to its hip flexion ability. Then you have the gracilis, which is the inferior pubic ramus and the ischial ramus, and that's going to insert down here. Okay, again, kind of this medial proximal part of the tibia into that pes encinaris insertion, which is again sagittarius, gracilis, and the semimembranosus. Okay, so the gracilis muscle, aside from adducting and internally rotating, it can also flex the knee and medially rotate the knee when it's flexed. And those are the adductor muscles. So moving to the posterior section, so of course you have the gluteus maximus, which is going to cover the whole back side, but I'm going to talk about the gluteus maximus with the gluteal muscles. So putting that aside from now, you have the hamstrings. So you have your biceps femoris, which is also known as your lateral hamstrings, and you have your semimembranosus and semitendinosus, which are known as your medial hamstrings. The biceps femoris has two heads. The long head comes from the ischial tuberosity and then down to the head of the fibula. And then you have the short head that comes from the lateral lip of the linea aspera down to the fibular head. The nerve for the long head, like the other biceps, is going to be tibial. The nerve for the short head is the peroneal or fibular, as Newman calls it. So note that only the long head of the biceps has an action at the hip. So the long head of the biceps is going to extend the hip. It's also going to flex the knee, and any hip that extends, any muscle that extends the hip can also do a posterior tilt of the pelvis. Okay, it can pull down on the pelvis. And I did mention this before, but any hip flexor muscle can do an anterior tilt. Okay, so coming back here, your medial hamstrings are your semimembranosus and your semitendinosus. They both come from the ischial tuberosity. The semimembranosus is going to come to the posterior medial tibial condyle, and then the tendinosus is going to come kind of in that same area, again, kind of proximal medial tibia, but it's going to go into that pes encinaris insertion. Okay, so that pes encinaris insertion, again, goose's foot, that's what it means in Latin, is the semitendinosus, think tendinosus, tendon, gracilis, and sagittarius. They're all going to come into that region right inside there. And then moving on, you have